When my mom was diagnosed with stage 3B lung cancer in October of 2003, she discovered a great injustice. Why was the survival rate of lung cancer, the biggest cancer killer, just 15.5% when breast, colon, and prostate survival was in the 80 to 90 percentile? She promised she would find out why and work on getting lung cancer survival to those same amazing survival rates. In 2006, our family, along with two close friends, started the Bonnie J. Addario Lung Cancer Foundation. We decided to empower and educate patients on the issues holding lung cancer from becoming equally as survivable as the other top 3 cancers. We would also build strategic collaborations and raise public awareness about the world's #1 cancer. Our end goal is to transform lung cancer into a chronically managed disease by 2023 and eventually to a cure. In our first year, we discovered many barriers to research for lung cancer and to patient education that needed to be addressed. In very short order, ALCMI, the Addario Lung Cancer Medical Institute, was formed, a global research consortium made up of academic institutions and community hospitals. We are proud of what we have accomplished in the past 11 years and excited about the future. Our goal is to serve all patients with this disease. Here are a few of our high-level accomplishments and the work we have done to break down these barriers. Our patient programs and services team offers free of charge, one-on-one support for patients, teaching them how to navigate the lung cancer care process from diagnosis to treatment and beyond. We assist and coordinate second opinions and help them decipher the sometimes difficult to understand nuances of the healthcare system. Our 360-degree patient education handbook is our comprehensive go-to source for lung cancer information. It is translated into Spanish, Chinese, and English. We found another barrier in patient support and created the Living Room Support and Education Speaker Series called Bringing Hope Home. We invite guest speakers, either solo or on panels, to discuss critical topics for lung cancer patients. It includes a live chat with viewers as well. We have reached almost 900,000 people in 144 countries. Because we know that patients are a huge part of the solution and that data is king, we created an open-source lung cancer patient registry which allows patients to enter their own data worldwide to accelerate research. Patients can opt in to enter their health history and electronic health records. There will also be a clinical trial match program in early 2018. 80% of all cancer patients are treated in the community hospital setting, which many times do not have the same standard of care as academic centers. We created a program called the Lung Cancer Community Centers of Excellence to address the need to bring academic-like specialty care into the community. We now have 18 of these centers in 11 states serving over 5,000 patients. Innovation is key. We fund novel research initiatives at some of the world's leading cancer centers. In order to do this research, we know the importance of collaboration. We have established several research awards through alliances with other nonprofits, including the American Lung Association and the International Association for the Study of Lung Cancer. We continue to fund our Young Investigators Award to identify brilliant, outside-of-the-box thinkers who can collaboratively deliver meaningful results. We are very excited about our recent crowdsourcing challenge that works with data scientists and engineers to build tools which put artificial intelligence in the hands of clinicians. Through ALCMI, we have built a one-of-a-kind international lung cancer research consortium comprised of 26+ academic and community hospital member institutions in the US and Europe, and soon in the Middle East and South Asia. ALCMI is now participating in 12 studies. Our first research study, CASTLE, created a biobank which collects blood and tissue from late-stage lung cancer patients. Our INHERIT study is a detailed analysis to understand lung cancer genetics in families. We have now completed the first phase of our Genomics of Young Lung study, fueled by Jill Costello and Jill's legacy. Some of ALCMI's other exciting studies include 3 studies that are exploring liquid biopsies. We are now in the second phase of our ROS1 project, started by patients, which includes 3 studies that go beyond lung cancer and into all cancers that show the ROS1 marker. Because of our recognition as being a global leader fighting lung cancer, many members of the ALCF team have been invited to present and serve on panels at national and global conferences. In August 2016, Bonnie was invited as a patient advocate to the Cancer Moonshot Summit in Washington, D.C., where she brought ALCF's message to Vice President Biden and Task Force CEO Greg Simon. We have been helping to design clinical trials and patient consent forms to get patients access to more clinical trials. We were part of the effort to have Medicare pass early detection, and many team members have been published as experts in the field of lung cancer. We are being heard. Since our founding, we have raised almost $30 million for research, awareness, and patient support, but that's just the tip of the iceberg. This is a snapshot of what we do at the Foundation. We thank each of you for your generous support and donations. We simply would not be where we are today without you. To get to our 2023 goal of making lung cancer a chronically managed disease, we will continue to do innovative studies and grants and offer free programs and services to support patient care. We want you all to be part of ALCF's future and appreciate your continued support, getting us even closer to our goal and to eventually finding a cure.